How is autism diagnosed? Autism assessment explained for parents. Hey there, welcome back to SpectraTunes. One question we often get asked is, how do doctors know if a child has autism? Can it be diagnosed through a blood test, a brain scan, or another method? In this video, we'll break down the entire autism diagnosis process, from early signs to a professional evaluation. We'll also delve into what parents should expect and why early diagnosis can make a huge difference. Let's dive in. What does diagnosis mean? Diagnosis is all about identifying if a child has the traits of Autism Spectrum Disorder. Autism isn't diagnosed through a blood test, on X-rays, or an MRI. Instead, professionals carefully look at a child's behavior, communication, social interactions, and developing history. Since autism affects each person uniquely, every assessment is tailored to the child and their needs. The goal isn't to label the child, but to deepen understanding of how they learn, communicate, and interact with the world. Why early diagnosis matters. A lot of parents opt to wait because they think, my child will improve with time. Boys don't speak till later, they'll grow out of it. While there is a possibility that children may improve over time. Early support gives children the greatest chance of learning essential life skills. Research shows that early intervention can greatly enhance communication, social skills, learning abilities, and independence. Who can diagnose autism? Autism diagnoses are usually finished by certified professionals. These professionals could include pediatricians, child psychologists, child psychiatrists, pediatric neurologists, speech-language pathologists, and occupational therapists. Often, a team of professionals works together to evaluate each child's development. The first step, parents notice signs. The diagnosis journey often begins at home with parents. They may notice problems with their child, such as not responding to their name, avoiding eye contact, having a hard time with speech, repeating certain movements, or getting upset by small changes. Parents often discuss these concerns with their pediatrician. The doctor looks at the child's progress and decides whether further evaluation is needed. Developmental screening. Many pediatricians perform developmental screening during regular checkups. These screenings involve simple interviews that parents fill out. The questions help them determine if there's any need for further evaluation. Screening is not a diagnosis. It's just a way to figure out if a child may benefit from a more thorough evaluation. The comprehensive autism assessment. If there's a suspicion that your child might have autism, the process starts with a comprehensive assessment. This might include checking in on your child's play routine, looking at their interactions with others, assessing how they're communicating. Looking at any repetitive behaviors they display, looking over their medical and developmental history, talking to the parents. Sometimes we use tools to make observations more consistent. The process usually takes a couple of visits instead of just one. What the professionals look at? Professionals pay close attention to some key areas of development, like social interactions, language skills, eye contact, playing, learning abilities, behavior, sensory processing, all things related to daily life, motor skills, their strengths and interests. You don't have to have just one sign of autism. It's more about the developmental pattern that matters. After the diagnosis, when you hear the word autism, there are a lot of emotions to deal with. Some parents are worried and stressed out. Others are happy because they finally understand their child's needs. Keep in mind, a diagnosis doesn't make your child any different. It just helps people find the right therapy, educational support, and things for them to use. Every child with autism has their own strengths, talents, and the ability to learn. With a little bit of understanding and support, they can keep growing and thriving. Thanks for watching. If you enjoyed this video, hit the like button, share it with others, and subscribe to our channel for more content. We will be back with our next video covering autism treatment. Can autism be cured? See you then!